Understanding supply chain management. It's a busy Monday at Say Hospital, and Eric is reviewing a shipment of malaria drugs. His job involves supply chain management, the art of planning, controlling, and executing the flow of goods, information, and finances from suppliers to patients. It's like orchestrating a market day, ensuring every store has what it needs to serve customers. Supply chain management covers demand planning, source materials, production, inventory management, transportation, and even handling returns of defective items. It requires change management, collaboration, and risk management to keep everyone, suppliers, hospital staff, and patients aligned. It also considers environmental, social, and legal issues like sustainable procurement and corporate social responsibility, ensuring the hospital's operations benefit their community and environment. Example: Eric needs 500 packs of anti-malarial drugs for Say Hospital's outpatient clinic. He forecasts demand based on last year's malarial season, sourcing quality drugs from a trusted supplier in Accra, and ensures they are delivered on time. If a batch is faulty, he arranges returns, keeping the supply chain smooth. You can now explain supply chain management as the coordination of products, information, and financial flow to meet customer needs efficiently. What is logistics? As Eric walks through Say Hospital's pharmacy, he thinks about logistics, the backbone of supply chain management. Logistics is the management of the flow of goods, information, and resources like medicine, staff, or even energy from their source to where they are needed at the right time, place, cost, and quantity. It's about getting the right resources to the right place, just like ensuring kente cloth reaches a tailor in time for a festival. Logistics integrates transportation, inventory, warehousing, material handling, packaging, and sometimes security. It adds values by ensuring resources are available when and where patients need them. A pregnant woman arrives at Say Hospital needing an emergency C section. Eric's logistics ensure the operating theater has sterile equipment, blood supplies, and oxygen tanks ready, saving her life. You understand logistics as the management of resource flows to meet consumer needs with time and place utility. Now let's move to the types of logistics. Eric's day involves juggling different types of logistics at Say Hospital. Let's follow him to see these in action. 1. Business logistics. This plans and controls the flow of goods and services from origin to use. It's about getting medicines and or equipment to patients efficiently. Eric ensures Say Hospital's pharmacy receives insulin from a supplier in Tema, stored properly and dispensed to diabetic patients on time. 2. Military logistics. This focuses on supporting military operations, but in healthcare, it's like ensuring readiness for emergencies. During the cholera outbreak, Eric coordinates rapid delivery of IV fluids, ensuring Say Hospital is prepared like a military base for a crisis. 3. Event logistics. This organizes resources for specific events like health outreach programs. Eric plans a free health screening in a Kumasi community, arranging transport for nurses, tents, and testing kits to serve hundreds of residents. 4. Service logistics. This manages resources to support service operations, like hospital maintenance. Eric schedules technicians to serve says hospitals generators, ensuring uninterrupted power for surgeries. We can now identify the four types of logistics: business, military, event, and service, and their roles in healthcare. Now let's move to the movement in the supply chain. Eric's phone buzzes with a message from a supplier. It's a reminder that logistics involves three key movements in the supply chain. One, information flow. This is about sharing orders and delivery updates. Clear communication is vital. Eric orders 200 boxes of gloves for Say Hospital. He emails the supplier precise specifications, ensuring the right type arrives. If the order is unclear, the wrong glove could disrupt surgeries. 2. Product flow. This is the physical movement of goods from supplier to customer, including returns. A supplier delivers syringes to Say Hospital, and Eric arranges for faulty ones to be returned, keeping the supply chain flowing. 3. Financial flow. This involves payment, credit terms, and financial arrangements. Eric negotiates with the supplier to pay for medical equipment in installments, allowing Say Hospital to afford a new ultrasound machine. You understand the three movements: information, product, and financial flows, and their importance in supply chain logistics. We move to the role of logistics in healthcare delivery. Why does logistics matter at Say Hospital? Because it ensures patients get the care they need. Logistics supports healthcare delivery by ensuring availability, getting medicines and equipment to the right place at the right time. During a malaria surge, Eric's logistics ensure Say Hospital's pharmacy is stocked with artesunate, treating patients promptly. 2. Reducing costs. Efficient logistics cuts waste, like avoiding overstocked or expired drugs. Eric uses inventory software to track drug expiry dates, saving Say Hospital from wasting money on unusable stock. 3. Improving patient outcomes. Timely resources means faster, safer care. Eric's quick delivery of oxygen tanks to the ICU saves a patient struggling to breathe during an asthma attack. 3. Supporting staff. Logistics provide staff with the tools they need to work effectively. Eric ensures nurses have enough gloves and masks, allowing them to focus on patient care without delays. We can now explain how logistics ensures resource availability, reduce costs, and improve patient and staff outcomes in healthcare. We move to benefits of effective supply chain and logistics management. Effective supply chain and logistics management bring benefits like: 1. Optimized inventories, keeping just enough stock to avoid shortage or waste. Eric maintains a lean stock of bandages at Say Hospital, enough for emergencies, but not so much they expire. 2. Lower costs. Streamlined processes save money. Eric negotiates bulk discounts on IV fluid, freeing up funds for a new clinic wing. 3. Higher productivity. Efficient logistics let staff focus on care, not shortages. With reliable deliveries, Eric's hospital doctors perform more surgery without waiting for supplies. Shorter lead times. Faster delivery improves care speed. Eric's quick sourcing of vaccine during a measles outbreak protects children in Kumasi. 5. Greater customer loyalty. Reliable services build trust. Patients return to Say Hospital because Eric ensures consistent high quality care with available resources. Now we see how effective logistics leads to optimized inventory, lower costs, higher productivity, shorter lead times, and greater patient trust. We can't leave the challenges of logistics management. So we move to the challenges of logistics management. Eric's work isn't always smooth. He faces challenges that test his skills. 1. Regulatory compliance. Meeting Ghana's health and safety laws is complex. Eric must ensure all imported drugs at the Sale Hospital meet Ghana Food and Drug Authority standards, avoiding costly delays. 2. Supplier coordination. Managing independent suppliers can be tricky. A supplier delays delivering thermometers, forcing Eric to find an alternative to keep Sale Hospital's clinic running. 3. Information gaps. Poor communication disrupts logistics. Eric once received wrong side syringes because a supplier misunderstood his order, delaying vaccination. 4. Cost management. Balancing quality and budget is tough. Eric wants high quality surgical tools but must negotiate prices to fit their hospital's budget. 5. Infrastructure issues. Poor roads or power outages hinder deliveries. During rainy season, bad roads delay medicine shipment to Say Hospital, forcing Eric to use costly air transport. We can identify challenges like regulatory compliance, supplier issues, communication gaps, cost management, and infrastructure problems in logistics management. Now let's look at logistics versus supply chain management. As Eric reviews his day, he reflects on a question he often hears. Isn't logistics the same as supply chain management? Not quite. Logistics is a key part of supply chain management, focusing on moving goods, information, and resources efficiently. Think of it as the delivery track. Supply chain management is broader, like the entire market system, covering strategic sourcing, procurement, and coordination across partners. Eric's logistics ensure bandages reach their hospital's wards on time. That is logistics. But he also negotiates long term contracts with suppliers for better prices and plans inventory needs for the next year. And that is supply chain management. Now we understand that logistics is a component of a broader supply chain management, focusing on movement and storage. As Eric closes his office at Say Hospital, he thinks about the patient who received care today. A child vaccinated, a mother saved in surgery, a community healthier because of his work. You followed his story, learning how supply chain management and logistics keep healthcare running smoothly. You've explored the types of logistics, their vital role in patient care, and the challenges that make this work both tough and rewarding. Next time you visit a hospital or clinic in Ghana, think about the medicines on the shelves, the equipment in the theater, and the people like Eric making it all possible. Logistics is the heartbeat of healthcare, ensuring resources are there when lives depend on it. Thank you for joining this journey, and I encourage you to keep on exploring this critical field. Until our next lecture, bye. Thank you.